Indiana University says it plans to attack the opioid crisis on all fronts, and it's putting $50 million behind the effort. As Lindsay Wright reports, the initiative is one of the largest collaborations in the country that's aimed at fighting the opioid epidemic.
IU President Michael McRobbie made the announcement at the State House alongside Governor Eric Holcomb. Then a video played.
I still can't believe that they would make choices that they did that night. This can happen to anybody. No families are untouchable.
The video shared Becky Savage's story. She lost not one, but two of her sons after they experimented with opioids during a night of partying. McRobbie says the stories of loss are becoming all too familiar.
It affects IU faculty, staff, students, alumni, and their family, friends, and neighbors. People are dying, and we must act.
That's why IU is pledging $50 million, rolled out over 5 years, to tackle the state's opioid epidemic. Through the multifaceted research project, IU is working with the state and health operations like IU and Eskenazi Health to collect and analyze data, address the clinical work shortage, create better policy, and more.
IU's efforts to respond to the addiction crisis will be aligned in this way with state and federal government efforts and will include collaboration with the Indiana congressional delegation, local communities, industry, NGOs, patient groups, and many others.
Holcomb says combating the opioid crisis and expanding treatment are top priorities for his administration. He also positioned the state's first ever drug czar. But he admitted, until last year, he didn't realize the scope of the problem.
When Hoosiers started sharing with me their most personal stories, it seemed like everywhere that I went, it quickly became apparent for me too that this crisis affects everyone.
Holcomb says IU's initiative in collaboration with state efforts will save lives. And team leaders on the project say perhaps the most vital partner is the public.
It's not just the scientists, it's not just the teachers. We need to partner with our community to understand their experience and the interventions and the support that they need in partnership with us to help address this addictions crisis.
Now, this is the third Grand Challenge project the university has awarded. The previous projects announced were a precision health initiative and environmental change research. Lindsay Wright is here now. Lindsay, addiction, like those topics, cover a huge area. How are these partners going to be able to measure the success?
Well, they recognize right out of the gate they're not going to be able to stop addiction, but the goal is to reduce the number of deaths. So in 2015, 1,200 people in Indiana died from opioid overdose. So IU has detailed 5 areas which the initiative looks to improve. That includes education, collecting data, collecting research, working with legislators to create better policies, and engaging with the community. So those are broad areas, but the money will also go to hiring 10 new faculty at IU, along with research and science positions. But that's about as specific as IU President Michael McRobbie got.
So now, how does the state get involved in this project?
So it's not clear how the state will be, what role they will be playing. But Governor Holcomb admitted that he wasn't really sure of the scope of the problem, but now he realizes it's widespread. So there are a lot of partners involved in this project. It's not clear what they will be doing, but it's very clear that it has Holcomb's complete support.
And really quick timeline for this issue?
$50 million rolled out over 5 years, but in terms of when they want to reach specific goals, there's no real timeline that's been laid out.
Okay, thank you very much, Lindsay.
You're welcome.